Hi, I'm Di. I've been a registered nurse for 42 years and I currently work in a quality unit in a small regional hospital of 80 beds. But I've also worked in large hospitals where I've been a surgical nurse, a hospital coordinator, a clinical educator, and I've also been a policy writer. And I want to talk to you about how we sometimes use creativity or lateral thinking when we work as nurses and in all aspects of our health service delivery, really. One such example is an occasion where there was a disaster at work. I came on duty and to see the switchboard operator throwing her arms in horror as her switchboard had just crashed. This had serious implications because it meant we couldn't convey to the emergency teams that there had been a cardiac arrest. So what we did was had a think tank with a group of us, and then we strategically placed laptops, PCs around the organisation with an email address set up so that should there be a cardiac arrest in a particular ward, we could just press the send button and the emergency team would be able to respond, having been informed via the public address system, which fortunately was intact. So that went well. One small hiccup was the fact that a lot of nurses, believe it or not, didn't know how to use email, but we overcame that pretty quickly. In the area of education, a colleague had a week and a half to implement a program. So a tall order, but she did a quick 5-minute presentation. She saved it to a PowerPoint, and then she took that with a mobile projector to all the nurses in the hospital, and she found them in pain rooms, so she would display it on pain room walls, office walls, meeting room walls. Wherever she could find a blank space, she would show it to any nurses who were available. And because it was quick, it was really agreeable. She got 90% of the nurses covered in that brief period of time. Another colleague talks of an occasion when she had a rather sad patient who was suffering dementia, and of a night he'd be quite distressed because he couldn't find his wife. So after discussion with the family, they decided to make a life-size stuffed toy, for want of a better description, who would go to bed with him, and he had something to cuddle. He felt a presence in his bed, and that calmed him down. His anxiety subsided phenomenally, so everybody was really happy. So we have policies, guidelines, protocols, systematic approaches to healthcare, but sometimes we need to employ lateral thinking and creativity to bridge the gap where those systems and processes don't cover our needs for our patients and clients in healthcare.